With Maui Memorial Medical Center set to transition to management under Kaiser in just about a week, we invited Dr. Yulin over to share with us some details about the transition. I know there's a lot of questions in the community about what services will be like going forward. With the management changing hands, can you tell us what the Maui medical system is?
Sure.
And how they will service Maui, Lanai, and Kula?
Fantastic. So Maui Health Systems is the umbrella organization that will oversee the three medical centers, both at Maui Memorial, at Kula, and at Lanai Community Hospitals. It will be an organization that is affiliated with Kaiser Permanente, but has a board that is Maui-based, and care will be focused on patients on Maui.
So, you know, there are patients who are Kaiser affiliated, they're members, and there's also a lot of patients who maybe have other service providers. Can they still go to the hospital?
So we want to be very, very clear that our goal is, this is a community hospital. All three of these are community hospitals. We want everybody on Maui to feel very comfortable getting their care at Maui Memorial, Kula, and Lanai. Maui Health Systems is Maui-based. It does not matter what your insurance is. It does not matter who your physician is. Everybody is welcome and will be taken care of. And we plan to provide patient-centered, evidence-based, highest quality care possible for everyone.
Okay. Does the transition in any way mean that there will be more specialty services on the island?
So I am very hopeful that we will have more specialty services on Maui. Our goal is to provide Maui care on Maui, which means we have to provide more services. Recruiting to Maui, as it is to all of Hawaii, is very difficult. Maui has about 101 FTE shortage, which is about a 25% shortage. So recruiting here is difficult. We are already in the process of bringing in 2 orthopedic surgeons. We are bringing in some neurohospitalists to provide, to help with stroke care. We are looking very closely at a traumatologist who is a trauma surgeon who will develop a trauma program for Maui. We understand there's an issue around neurosurgery right now. We are recruiting as fast as we can, but it does take time. It does take time to bring providers to Maui. I think specialty services will expand slowly and steadily on the island. The first goal of this transition was to stabilize calls, so the emergent services were available at Maui Memorial. We're very close to having that as a reality. And then it becomes, how do you expand services? How do you provide new services on Maui?
If I'm a Kaiser Permanente member, would I be able to see my physician at the hospital? Is that how that works? Or do you go to your regular location where you live?
So for a Kaiser Permanente member, if you're doing day-to-day care, you're going to be still seen in our Kaiser Permanente clinics, just as you are today. If you are in the hospital, for the most part, our Kaiser Permanente physicians will provide the care, but not always. We basically, on an emergent basis, share patients with the community physicians both directions. So we see their patients and they see our patients depending on the call schedule.
And then what about friends and family that currently work at the hospital, the Maui Memorial Medical Center? Is there any changes in their employment or how they'll be servicing patients there?
Sure. So we're thrilled that so much of the care on Maui is going to be provided by our friends and family on Maui. It is so important to the stability of the hospital. Over 97% of the current employees have accepted new jobs with Maui Health Systems. The care you get on Maui will be delivered by our folks. We are going out into the community and recruiting. We have gone to the college and we're accepting large amounts of their graduating class. In fact, I think we took 100% of this year's graduating class into MHS. We would very much like to see an expansion not only of the RN program, but social work program, CNA program, every program possible that the university could provide to provide us staff. Because we know that if you train on Maui, you're going to stay on Maui.
That's awesome. I know that in the past there's been a lot of nurses brought in from off island. Is there any approach that Kaiser Permanente is taking to maybe make it a more island-focused service?
So, MHS, at the present time, MMMC and HHSC, the state, have had shortages, and they've had to bring a lot of travelers into Maui. As we transition to MHS, we feel like there will be less need for travelers, but I can't tell you that today those slots are all going to be filled by locals. But it's not advertising for them and wanting them. If we find somebody from Maui who would take those positions, we would be thrilled.
So as we prepare for the transition, what's the approach that Kaiser Permanente is taking towards integration of the Maui community?
I feel like the work that MHS will do for Maui goes outside the brick and mortar structure of the three hospitals. We need to integrate the community into our care. We are very aware of the community voice in how we provide care. So it is very important that the community be empowered to tell us what they need and how to best provide for their services. We also need at MHS to go out to the community, to outreach to the community services. We need to build links to community social work, community behavior health services, the continuum service, the long-term care, hospice care on Maui. The community of Maui needs to feel empowered that they have a voice in the future of healthcare on Maui.
Just for the community in general, any sense of assurances that everybody will have access to medical services that they need?
Yes, thank you. I think that's one of the most important points here today is these are community hospitals. They are open to everybody on Maui, Lanai, who goes to Kula Hospital, regardless of your insurance plan, your physician. We want to provide care for everybody that needs care.
We just want to thank you so much for coming in and providing a little bit more insight for the community into how this transition will take place. We're looking forward to the transition coming up on July 1st. More details available on our website at mauinow.com.